A lot of people view it as so healthy that a lot of young people, children, are using e-cigarettes now.
And then they're going to transition to cigarettes.
That's the fear. And actually, the cigarette companies are buying these e-cigarettes and promoting e-cigarettes now. So right now, the use of e-cigarette, even experimentation among middle school and high school students, has increased tremendously, with millions of students having used them just in 2012. So it's something to think about. If you're trying to get away from smoking, it's probably a good thing. If you're just experimenting with it, it may lead to smoking, which is probably a bad thing. And realize that we do not know the implications of e-cigarettes.
Well, it would take about 10, 15 years.
Probably would take many years, and we wouldn't want to be saddened or shocked by bad results. So the best thing is probably what?
No cigarettes.
No cigarettes, no e-cigarettes, no real cigarettes, no cigars, because we know they're very dangerous for your life, your body, for inducing cancers, heart disease, and other sicknesses.
Nothing good can come of that.
Nothing good can come of that. Now, how's our studio doing? Are we ready for a word from our sponsor? For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. At Radiosurgery New York, the radiosurgery pioneers, that's our goal too. We're first in America, first in New York, first for you with body radiosurgery. We hit your cancer from head to toe with no cutting, no bleeding. We have decades of experience with primary and metastatic, large or small cancers. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are the best results and quality of life. Hi, I'm Dr. Gil Lederman. For a free booklet and DVD, call 212-CHOICES. 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. We're super convenient, Broadway and 38th in Manhattan. Hyperthermia 2. To hit your cancer, call 212-CHOICES. 212-CHOICES for Radiosurgery New York. For prostate cancer treatment, results and quality of life matter. Hi, I'm Dr. Gil Lederman from Radiosurgery New York. Our enviable record includes treating thousands with prostate cancer. Critical to every man with prostate cancer and their loved ones is quality of life, urinary and sexual, and great treatment data while avoiding surgery. Treatment here is outpatient, with most insurances, Medicare, Medicaid accepted. First in America with radiosurgery for cancers from head to toe, we have the expertise to hit the cancer. Our fresh second opinion could change your life. For prostate cancer treatment, call 212-CHOICES. 212-CHOICES. Radiosurgery New York. Super conveniently located in Manhattan at 38th and Broadway, hits the prostate cancer. Call 212-CHOICES. 212-CHOICES to hit the prostate cancer.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
Hey, we're back here. Dr. Lederman with Ariel. We're from Radiosurgery New York.
Hello, it's good to be back.
Yeah, it's great to be back. We just talked about the New England Journal article about what happens when urologists profit from prostate cancer. How do they feel about radiation then?
It's a great thing.
Yeah, they love it. And electronic cigarettes, we just talked about.
It's a bad thing.
It might be bad, it might be good, we just don't know. We've got Dr. Eisen on the line. Dr. Eisen is a Spanish-speaking doctor. He's speaking at 20 churches this weekend in Spanish for cancer patients. Good morning. Buenos dias.
Buenos dias, Dr. Lederman.
So where are you speaking this weekend? I know you're speaking at a lot of places this weekend, talking about radiosurgery and other things to Spanish organizations and churches.
Yes. On Sunday, I'm going to be at the Marriott Hotel at LaGuardia Airport with it's a major conference for all the association for Spanish-speaking physicians in New York, And one other thing that I'm going to present, not just only the whole treatments of patients, but there is an article that talks specifically about the use of radiosurgery for liver metastasis.
So what is radiosurgery? Can you explain how radiosurgery allows us to hit the cancer without hurting healthy tissues?
Well, radiosurgery, it's essentially a way of delivering radiation in a very focusing way to the tumor without creating problems all around the area of the tumor.
And it's only 5 treatments. It's non-invasive. There's no cutting. There's no bleeding. There's no hospital stay, right? There's people just come in, get a treatment, and 15 minutes later they're going out for coffee at Starbucks.
Exactly. For example, one of my patients with colon cancer with liver metastases, he has 2 metastases in the liver, which gave him 5 treatments on each side on the liver. Patient went home, no problems, and now just came back for a PET scan. And exactly at the way that I'm going to report, the control is close to 90%.
90% means that the cancer stops or shrinks or goes away for the rest of the life of the patient where we treat, right?
Exactly.
And that's true even if the patient had surgery, if the surgery didn't work, if chemo didn't work. Radiosurgery allows us a second chance to treat the cancer successfully. We're going to talk about some other cases today. If patients want to hear you, are you available at LaGuardia Airport for the patients, or is it only for doctors this weekend?
I will be available, number one, always for the patient.
So how do they find you? How does a patient find you?
They can call me at 917-836-8105.
And you speak Spanish fluently? What's your number in Spanish?
That's 917-836-8105.
Can we have that again, please?
917-836-8105.
And are you talking at any churches this weekend?
Yes, I'm going to be at our that's a church in Dyckman and Broadway, Our Lady, Queen of Martyrs. It's going to be a whole presentation specifically on breast cancer and the use of radiation. I'm going to be also with...
What time is that? What time and what day is that?
That will be on Sunday from 1 o'clock to 5 p.m.
All right, so if patients want to go there, they can call you and make arrangements to hear your lecture?
Absolutely. The beauty of that specific lectures is going to be given all in Spanish. It's a huge community up in Washington Heights.
So again, that's Sunday at 1 o'clock?
Sunday at 1 o'clock, and they can call me at...
What's your number again?
917-836-8105.
Okay, good luck with all your lectures this weekend, and if patients want to call, please feel free to call him there or at 212 Choices, which is our office just a few blocks away from the ABC studios at 38th and Broadway. Thank you very much, and have great lectures.
Okay, thank you. Bye-bye.
So we also had several interesting patients I wanted to discuss. I know we don't have much time, but I want to go through these patients because they tell the listeners a lot about the work that we do.
Let's hear.
Okay, so patient number 1 was a man who had colon cancer. He had surgery and chemotherapy several years ago, and the cancer unfortunately came back last summer.
I know that's a common treatment for colon cancer.
Right, but his cancer came back. His chemo doctors sent him to us for radiosurgery, which is non-invasive treatment just to hit the cancer.
And it came back in the colon.
And no, it didn't come back in the colon. It came back in the lung. So and actually, when the doctors thought it was only in the lung, we staged him up. We found cancer in the lung and the liver. We treated both sites with radiosurgery, and both sites went away. Then he started chemotherapy to try to stop the cancer in the bloodstream. He had one type of chemotherapy which he didn't tolerate. He had another type of chemotherapy, and on that second type of chemotherapy, the cancer grew. So now he came to us this week with 3 new spots. One in the scar, in the abdominal scar where the surgeon operated on him, which would suggest the surgeon actually spread the cancer when he was...
maybe some tumor spillage during surgery?
Yeah, tumor spillage is a nice way of saying that when the doctor was removing the colon cancer and sewing up the wound, some cancer cells